ya está Christopher Drake con nosotros, que el dióxido de carbono regula la actividad del sistema nervioso, del sistema digestivo, del sistema cardiovascular. Es decir, a medida que nosotros vamos restableciendo el nivel de dióxido de carbono en nuestro organismo, todos estos sistemas empiezan a funcionar correctamente y todos los síntomas crónicos que tengamos se van a ir revirtiendo. Hay mucha gente que ya dice que está sintiendo los beneficios, entonces lo que yo diría ahora es empezar directamente con las preguntas, aprovechar el tiempo de Christopher que está con nosotros y para evacuar sus dudas. So, hello Christopher, welcome.
Hello, Nico.
Bueno, podemos empezar con las preguntas. De mientras decirles que Christopher Drake es el primer instructor certificado fuera de Rusia. Enseña el método desde hace más de 30 años, ha entrenado a más de 20.000 estudiantes y le ha ayudado a revertir sus síntomas crónicos. Ha participado en las primeras pruebas clínicas que se hicieron del método en Australia para el asma. Y bueno, es muy bueno tenerlo con nosotros. Bueno, so, first question. How is the daily practice? How much time do we have to practice the method each day?
Well, at first, it takes more time because you have to get your skills up and you have to get your numbers up. And I should say at this point, you have to be a little bit fanatical. You have to be a little bit devoted a lot. But when you reach a certain level, it's not so difficult to maintain. You can practice less. But in the beginning, of course, it depends. Let's be realistic. If you're a small child with a very mild asthma, maybe a little bit blocked nose, you practice a little bit, not even very sincerely, but you practice, maybe 1 hour per day for 3 or 4 days, and everything is sorted out. On the other hand, if you are 65 years old with a COPD or serious emphysema with diabetes and some obesity, for example, you will have to commit yourself very strongly. You will have to do 10 times more effort. But if we know your condition and your control pause, we can be quite accurate as to what sort of numbers you need to reach. We can be quite precise, and we can be quite reasonable in accuracy, how long it will take you. But generally speaking, if the person is young and the conditions are not too serious, it's very fast, pretty easy. If the conditions become more serious, more medicamental intervention is involved, and as the person gets older, there's more complexities, so more work needs to be done. And there's one thing I can close on this question. You will not have to practice a lot and then hope that in the future you improve. You will improve within 2 or 3 days. The improvement will start quickly, but small things at first, and they become significant things within, so you don't have to wait for a long time to see positive results. But some people, like with the very serious diseases, they have to work for a long time to reverse their disease. But even in the first week, they begin to see some positive results.
Next question is someone who asked about Parkinson, if the method could help for Parkinson disease.
What I've seen in Parkinson's, the quiver or the shaking diminishes. And it doesn't take very long. To the extent at which the disease can be reversed, I'm not sure, actually. I've seen the most visible symptoms reverse. And sometimes there's some little left. There's some little quivering left. But mostly, those symptoms in particular diminish pretty quickly. But Parkinson's is much more complicated and more involved than just those symptoms. And I can't say how far it reverses the disease. I would assume that it stops the progress of the condition and that it would reverse it to some degree. But how deeply it reverses the disease, I can't be sure.
So finding out about how we should breathe, Ruby is asking, so what happens with yogis? Have they got it wrong?
No, I'm not sure if I can give the exact quote, but I can try to be close. From the Bhagavad Gita, the aspirant trains himself to suspend the breath in the nostrils, thereby becoming free of fear and greed. Maintaining this, he becomes liberated. The yogis who codified the work of the rishis, who actually developed what we call yoga today, the main contender was Patanjali. And it seems Patanjali had the view that unless you can hold your breath for 80 seconds, you're not healthy enough to practice yoga. You need some health issues sorted out. And I can give a lot more examples about the congruousness or similarity between Buteyko and the ideas of the fundamental ideas of pranayama and so forth. It's very difficult to find it now in contemporary yoga.
Entonces, estamos con la pregunta sobre que han hecho en el chat sobre cuál es el aspecto bioquímico del método, cómo funciona el método a nivel bioquímico, cómo es posible revertir enfermedades a partir de la aplicación del método. Chrsitopher dice que está relacionado con las funciones que cumple el dióxido de carbono en el organismo, que es una muy buena pregunta, pero que tardaría mucho tiempo en contestar.
Nico, maybe if you give them the link or point them to the biochemical analysis on the website, no?
Okay.
And because carbon dioxide is essential for all the major systems, from oxygen uptake to pH, aperture of vessels, blah 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 blah. It's to give a talk on biochemical analysis and the role of CO2 is a little bit complicated. But if the person enjoys biochemistry, then they should get some pleasure reading the biochemical analysis, because it was written by Karzimov, rather famous and highly regarded Soviet biochemist.
Dennis says that he has hemoglobin and hematocrit high. Could it be because of carbon dioxide? And also he did a control pose of 13. So maybe that gives you a reference of how to.
Definitely with a control pause of 13, all the major symptoms will be disturbed. He breathes for like 5 people, roughly. So you can imagine eating for 5 people, or sleeping for 5 people, or blood pressure for 5 people. What will be the result? I'm just doing rough calculation. It's not accurate calculation, but say between 4 or 5 people, his respiration. And because CO2 is so much heavier than nitrogen and oxygen, you will lose it easily from so much overbreathing. And he should see improvement, not cure, but improvement quickly of symptoms.
So children, Melina is asking about children. What numbers do the children have to arrive in order to be effective?
They do different exercises than adults. It depends what age we're talking about. Like it comes under 5 years, 5 years and older, and then up to after around puberty. And after that, after about 15, 16, they are treated like an adult. It depends on their level of development, but if it's under 12 or 13, it's kids, and 14, 15, it's already coming into like 17, whatever, it's coming into adulthood. And they do a different kind of exercises. They do some breath holding, but they also do some exercises like steps, walking whilst holding the breath, running whilst holding the breath. Children find it easier generally. They like it, not at first, but very quickly they like it, usually. And they get much quicker results than adults do. Children's workshops can look a little bit chaotic at first, but somehow they catch the essential. And when we work together with adults and the children together, sometimes the adults get a little bit envious because these children not concentrating so much, not paying too much attention, but very quickly getting very high results. And the poor adults have to really concentrate and work hard.
Ruben asked if this method could help to improve psychological disorders.
Yes. The progress of psychology and psychiatry has been to create diseases according to symptoms. It means that the diversity of diagnostics has developed infinite permutations, and every year they are introducing a few more diseases. And they miss on the critical point the synchronicity at which neurons synapse with the brain cells is linear to level of carbon dioxide. You can just observe very casually in any kind of environment in which people who are psychologically or psychiatrically unbalanced, you can see their breathing corresponds with that. Even when a normal person becomes very upset, their breathing deepens enormously. Any well-trained policeman or security expert just can observe somebody, and the first thing they watch for is noticeable change in breathing pattern. And so it's absolutely indicative. And on the other side of the scale, the the fellow who, as far as I know, or at least gave the most famous instruction on meditation was the Lord Buddha. And his central explanation on meditation is called Anapanasati.
Sutra.
And I think, I'm not 100%, maybe you can correct me, Nico, but I think it's like 17 steps of this process. And each of them, I think each of them always refers to watching the breath. I can talk a lot more on hypothesis and theory and so forth about mental disorders and how they can be vastly improved. But I can tell you from a practical level, just practical level, if you are quite devoted and you are willing to practice earnestly, the most common conditions, schizophrenia, bipolar, manic depression, and so forth, it's not a big deal to sort out depression and such things. It's not, yeah, it's hard in terms of effort and work and practice, but in terms of the job that needs to be done, it's quite simple and straightforward.
¿Por qué todos los métodos de respiración que enseñan, principalmente desde el yoga, enfatizan la respiración profunda? ¿No son buenos métodos?
Yoga goes back thousands of years ago, and the concept, the goal of yoga is to suspend the breath in the nostrils. The goal of yoga is to make breathing almost invisible at rest. And over the few thousand years from the beginning of like Patanjali to now, people's breathing has become much deeper. And because carbon dioxide is heavier than nitrogen and oxygen, there's been a chemical effect because of the deepening of breath, which was not occurring 1,000 years ago, or even 500 years ago. And we should be very clear about what is Buteyko method's objective. Body temperature should be 98.6. That's not in dispute. Blood pressure should be 120/80. That's not controversial. Pulse should be 60/70. This is considered a medical norm. Respiration should be 3 to 4 liters per minute. This is established as a physiological norm. It's not controversial. It's not an extraordinary idea or theory. Professor Buteyko just wants your respiration to be within the physiological norms. If somebody comes to us and they have a control pause, 50 or 60 seconds roughly, we might chit-chat with them, talk a little bit. Maybe we allow them to come to the workshop, but I'm not going to train somebody who has very good breathing. If you go to your doctor and your blood pressure is 120/80, he will just say, good, congratulations, and goodbye. And we will do much the same with somebody who comes with an optimal breathing. Maybe we can chit-chat a little bit, but we have no job with people who have physiologically normal breathing.
Vale, pues vamos a la siguiente, ¿no, Nico?
Ok, la siguiente pregunta es de Miguel Ángel, que dice, ¿el método puede facilitar la concentración y la mejora en la capacidad de memorizar, estudiar y la actividad intelectual?
To the extent of it being noticeable.
Muy bien, José Antonio pregunta, ¿puede mejorar a alguien que ha tenido infarto y angina de pecho? ¿Hipertensión también?
Well, all the symptoms in infarction and spasming of vessels, whether it's brain vessel or blood vessel or heart vessel, is basically the same. And all those conditions can be reversed with Buteyko method, and you can avoid having those conditions. The short answer is yes, but to the degree at which the severity of which would call catastrophic failure is going to determine how long and how much you can do with it, you know. Certainly angina pectoris, that's not difficult to solve out. That's quite straightforward. Stroke, if it's a very serious stroke, the results are not fast. They can feel better. They can get some positive results, but it's a long, my experience is it's a long job. If the stroke is very mild, it can be taken off. As for myocardial infarction, heart attack, well, certainly it's an example of something in which you would want prevention is better than cure, I would say, because often people don't survive it. None of those conditions can occur with a person who has a control pause above 30. It's not even possible.
Ok. La siguiente pregunta dice, mi pregunta es sobre los inhaladores en función de la bronquitis obstructiva. ¿Es recomendable? Y si es así, ¿cómo es la mejor manera de inhalar? ¿Corto o largo?
Are they talking about a steroid inhaler or a dilator inhaler?
A ver, la pregunta que hizo la persona que hizo la pregunta, San Francisco Ward, te pide una precisión si son corticosteroides o si son broncodilatadores. Quizás podés ponerlo, ok, corticosteroids.
Like
Salbutamol.
salmeterol or salbutamol?
Salbutamol.
Better to learn Buteyko method and you won't need it.
Es mejor aprender el método Buteyko y no lo vas a necesitar.
If you take the corticosteroid, then it's not doing any harm and it reduces inflammation. If you take the reliever medication,
Si tomas la medicación de alivio,
it brings relief, it will dilate the vessels, but unfortunately it deepens the underlying cause of the problem in the beginning.
Hola, buenos días o tardes, depende del país donde
Buenas
esté.
tardes, sí.
En mi caso particular, tengo 49 años. Soy diabético hipertenso de hace aproximadamente 22, 23 años. El año pasado, en noviembre, tuve COVID. Estuve con oxígeno, pero a raíz de eso, todos mis valores de glucosa y niveles de presión se me descompensaron. Que a la fecha no se me han podido regular, sobre todo el de la glucosa. En el ejercicio que hicimos ahorita, en el primero, yo duré 10 segundos. En el segundo ejercicio fueron 20 y en el tercero fueron 22, pero en el 22, en el tercero, me sentí muy fatigado y como si hubiera aguantado mucho más la respiración. Ahí qué pasa es por parte de la enfermedad. Con el sistema, pues lo que he visto y oído, pues creo que hay una posible solución o por lo menos estar más estable y controlado con mis padecimientos.
Yeah. Is the diabetes type 1 or type 2?
¿La diabetes es tipo 1 o tipo 2?
No, tipo 2. tipo 2.
Type 2.
Ah, and he's taking insulin or
¿Estás tomando
other
insulina?
medications?
Sí, es insulina y pastillas. Me inyecto insulina y tomo medicamentos y pastillas. Igual para la presión, estoy con medicamentos.
Yes, the method is very effective. He will be able to, if he works hard, he'll be able to reduce his insulin requirement by 50% within about 7 to 10 days. It's not a big deal. He should, is he taking long-acting insulin or short-acting insulin? Sorry, it's a bit technical.
Ya. ¿Estás tomando insulina de corto efecto o de largo efecto?
De largo efecto,
Long.
porque las de corto efecto no me hicieron, no me controlaban.
Because the short ones didn't work.
Yeah, they work, but you have to take them more often, obviously.
Sí, las de corto efecto sí que funcionan, pero hay que tomarlas obviamente más a menudo.
And they are inconvenient. So I would suggest that one can do basic training and things can improve a little bit. But then when you want to really solve out and come off this insulin and so forth, you must change from long acting to short acting. Why? Because long acting, we don't know if you need insulin or you don't need insulin, because the effect is going the whole day. But with short acting, you can reduce your dose and go according to your requirement. But we will never know what is the requirement, because the long acting covers a long period of time. So usually we talk to the doctor, explain the idea to titrate the insulin, and most of the time they're quite collaborative with that. And as long as you measure your sugar level properly and take the amount of insulin that you need, and that you can do the calculation and use a short acting instead of long acting. Otherwise, there's no way to know how much to reduce. And then
Ok, muchísimas gracias. Muy amable.
A ti.
the high blood pressure, that gets solved out much easier. Diabetes, you have to measure carefully, check everything regularly. The blood pressure, it's not such a big deal to solve out, much easier.
¿Cómo se combina el método con el ejercicio físico?
Well, if you overbreathe at rest, you will overbreathe under exertion. So, but to give general advice, if you must mouth breathe to catch your breath, then you should either slow down or stop what physical activity you are doing, because instead of helping you, it's damaging you. What you can't do physically with the mouth closed and some level of control, you should avoid. You don't help your health by gasping for air and massively hyperventilating.
¿Puede el método revertir la anemia? Can the method revert anemia?
Well, not without some supplementation, but certainly if the anemia has been brought about through leaching due to hyperventilation, yes. But obviously for normal anemia, you will need some supplementation as well.
Siri dice, buen día, excelente información, gracias por compartir. Y ella padece hipertensión arterial en los pulmones y el costado derecho del corazón. Se presenta cuando los vasos sanguíneos pequeños en los pulmones se hacen más estrechos y quedan cicatrizados. Esto aumenta la presión arterial en los pulmones dificultando el transporte de la sangre oxigenada hacia el cuerpo. Lo padece hace 4 años, le gustaría saber si puede hacer uso del método expuesto, aquí hay alguna variante.
Yes, it most definitely does, because increasing the CO2 increases the perfusion and diffusion, and then maybe, Nico, if you explain Bohr effect,
Okay.
you know, because that's the critical point.
Que dice que para que, el oxígeno se desligue de la hemoglobina y pueda llegar a los tejidos, tiene que haber una concentración suficiente de dióxido de carbono. Es decir, si no hay suficiente dióxido de carbono, el oxígeno puede estar en la sangre, pero no va a llegar a los tejidos. No se van a oxigenar los tejidos, que es lo que queremos. A través de este método normalizamos los niveles de dióxido de carbono en el cuerpo y eso va a hacer que el oxígeno se suelte de la hemoglobina con más facilidad y pueda llegar a donde es necesitada.
Había una persona en el grupo que tenía comentado antes en el chat al hacer las pausas que tenía EPOC. So he's probably interested to know if the method can work for COPD.
Yes, yes, it does work. And they see results pretty quickly, but to solve it out, it's not a simple, it takes time. It takes time and some work. Chronic obstructive pulmonary disease, it's not simple, but at least after 3 or 4 days, a week or so of practice, they can walk further. They can climb more steps. They can feel more at ease. They don't need so much medication. Their medication requirements drop. But to actually reverse the underlying disease, well, that can take, months and months, even years. But at least they can improve their situation. Instead of getting worse, they can start to get better.
Someone is asking if the method could help in the case of tinnitus. Así lo decís.
Ringing of the ears.
Yeah, tinnitus.
Tinnitus.
Is the tinnitus intermittent? And does it change in the sound frequency, or is it constant, non-stop, the same?
Fernanda, Christopher pregunta si el tinnitus es constante o si es intermitente y cambia la frecuencia, el tono. Si nos podés indicar eso. Yes, it is constant and it is in both ears.
It's a hard job. They have to, what's their control pause? Did they do control pause, Nico?
Yes.
Fernando,
Fernanda, ¿cuál era tu pausa de control?
They have other health issues as well, for sure, that they should treat. The tinnitus, maybe it can improve and become a little intermittent. Maybe there'll be some improvement, but I don't like to offer too much of a promise, except that if they make their control pause 30-ish, which is a big job for somebody who has a control pause of 10, that's a big job. It may take 4 or 5 weeks. It may take 10 weeks. I can't say how hard they will find it to get that far, but I would expect vast improvement, but not quick. Oxygen is transported in the hemoglobin of the blood. Carbon dioxide is transported in the plasma. They come together.
Van juntos,
Under pressure.
bajo, en un ambiente de alta presión.
And the CO2 exerts its influence and makes the hemoglobin less sticky.
Carmen, tu pregunta.
Yo quería hacer una pregunta con respecto a las pausas máximas caminando. Cuando yo hago la pausa máxima caminando, o sea, contando los pasos, lo que noto es que llego hasta los 50 pasos sin necesidad de respirar. ¿Eso a qué pausa de control corresponde?
Around 40s, like how many steps?
50.
50. That is similar to maximum pause of around 80 seconds, and a natural control pause when the maximum pause is 80 seconds would be 40. But with steps, you can force the number of steps because you can grow the carbon dioxide without it affecting respiratory center very much. So a person with quite a low control pause can do much greater number of steps. The numbers are not mutually exclusive. Many people can do 80 steps and they have not a high control pause, you know? So you can't make a linear conversion, but it's sort of indicative if you convert it through a normal maximum pause, but it's not going to be accurate.
Someone is asking, what do we think about one breathing method called Sudarshan Kriya?
What is it again?
Sudarshan Kriya. Seems something like yoga. It's from the art of living.
It comes like this. There's many different breathing methods, and they should have some purpose. If somebody is too skinny, they should eat more.
Deberían comer más.
If they are too fat, they should eat less.
Si están con sobrepeso, tienen que comer menos.
So you should first of all diagnose if there's some fault with the breathing. Yeah, if you diagnose the fault first, and then you aim to repair the fault. If you have no way of measuring, we have a control pause. If somebody comes with a high control pause, I will tell them, congratulations, I'm not going to take any money from you, except to say hello. Okay. But to give a generalized breathing method, it should have objective first. And I don't know what is the objective of this method of which you speak.
Ok, entonces lo que dice básicamente es que el método Buteyko tiene como objetivo normalizar la respiración, y tenemos una manera de diagnosticar cuál es el problema con la respiración, que es la pausa de control que le hemos enseñado. Lo que él no sabe es, en el caso de este método que enseñan en el arte de vivir, cuál es el objetivo de ese método.
There's another question. Hay otra pregunta de hipertensión, ¿vale? Rox nos pregunta sobre la hipertensión. So someone is very keen to know, we spoke about it, but specifically about hypertension.
Hypertension is a disease of deep breathing. Hypertension is a disease which comes from too much, which comes from over-breathing. And you can reverse it the same way that you acquired it, in reverse. Breathing too much will give it, and breathing less will take it away.
So
he's been experiencing that for 6 years. ¿Cómo son los médicos convencionales? No. So doctors don't give an explanation, only medicines.
Yeah, that's right. They open the vessels to stop the inflammation and spasming and so forth. And nobody with a hypertension has a high, even decent control pause, never mind good, never even to speak of good, even like they have a horrible control pause, always.
Acá Lilian Lilian pregunta sobre si hay un beneficio para los problemas a los huesos, artritis, artrosis.
Arthritis, of course, because when the pH in the body is disturbed, the body will take calcium off the bone to normalize the pH, to help normalize the pH. This calcium, it forms like a powdery substance, and eventually it will accumulate in joints, like fingers. They call it arthritis. It can occur around the teeth. They call it plaque. It can occur in the kidney stone or gallstone, hence kidney stones, gallstones. It can occur in the brain, and it's called Alzheimer's. And if you normalize the level of CO2, you thus, of course, will normalize the level of carbonic acid, for example, and that will dissolve these sediment of calcified deposit. With arthritis in particular, the inflammation comes off very quickly, and so pain is reduced very quickly, but it takes longer for the actual calcified deposits to be dissolved. It takes some time.
Arthritis. Fibromyalgia. So Maria Jose is asking about fibromyalgia.
Yeah, it's a couple of different stages there, but certainly within a few weeks you can see improvement.
Christopher, there are no more questions. Thank you very much for your presence.
My pleasure. You tell everyone thank you for the opportunity to meet them, and I wish them well, and maybe we see each other in a workshop. I need to go to my students now anyway, so.
Las prácticas las hicimos al principio y es importante, estas prácticas que les dimos pueden ser para un uso puntual, pero el reentrenamiento de la respiración tiene que ser con la supervisión de un instructor, ¿sí? El reentrenamiento con supervisión de un instructor calificado. Bueno.
Muy bien.
Bueno.
Gracias a todos. Lógicamente, los 50 que estéis aquí no vais a hacer el curso, pero si os lleváis algo, nada de respiración profunda y respirad siempre por la nariz.
Eso.
¿Vale? Y mantengan siempre este método como una opción para los problemas que puedan tener, porque funciona.
Sí, es un método que le va a dar poder sobre su salud, de regular su propia salud, de tener la posibilidad de no tener que visitar al médico nunca más y convertirse en su propio doctor.
Totalmente.
Bueno,
muchas gracias.
Muchas gracias y hasta luego.
Hasta luego.